Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. We'd like to make a response to an email that was sent out by the United Federation of Teachers, Michael Mulgrew. Check this out. So this email was sent yesterday afternoon. You can see here it says Michael Mulgrew, July 24th, 2024 at 12:36 in the afternoon. From UFT President Michael Mulgrew. And obviously, he thought he should be very proud about this. Earlier today, on the floor of the American Federation of Teachers convention in Houston, Texas, I motivated a resolution to seek federal legislation to protect Medicare and expand Social Security benefits for seniors, and to ensure these benefits will never be diminished. We've said for years we need federal intervention to protect all our health care benefits for both retirees and in-service members, and we can no longer wait for the federal government to do the right thing. We need to push for it, and the push starts with our retirees. This fight needs to be national. Protecting health care at the local and state levels isn't enough. I'm so sorry. Michael, honey, you haven't protected healthcare at the local level. Actually, in 2014, you diminished our healthcare benefits. And then in 18, you and some of the unions within the MLC, well, mostly you and Henry Garrido from DC 37, tried to privatize Medicare. So I don't even know how to respond to this question because I'm frustrated even reading this. And I'm going to tell you, of the over 300 plus emails when I stopped counting from your retirees, we're so fed up even reading this to think that you would be trying to advocate something on a national level to protect seniors nationwide when you can't even protect your own seniors right at home. Shocking. We need to wage a war against an industry that cares more about quarterly profits and bonuses than its patient care. But Bubala, let me explain something to you. You just were trying to force, for the last 3 years, retirees into privatized for-profit Medicare Advantage plans. For profit, honey. What are you thinking? The Republican Party's dangerous 2025 presidential transition project calls for the repeal of the 2022 Inflation Reduction Act, which for the first time provides Medicare with the ability to directly negotiate prices of certain single-source brand name drugs. If this law is repealed, drug prices will rise. Seniors across the country who are enrolled in Medicare D will lose out on the $7.4 billion in savings next year. In addition, the U.S. Supreme Court's recent ruling in the Chevron case threatens the federal government's ability to ensure hospitals' participation in the Medicare program. Let's not forget, our members pay into Medicare and Social Security throughout their careers, and we cannot let opponents chip away at these programs. Our retirement security depends on them. No one works harder than the public school educators, nurses, and other public employees. Push for this federal legislation is just the first step in a campaign to protect the health care of all UFT members, both working and retired. With so much at stake at the elections in November, Congress needs to lock in Medicare and Social Security benefits, and it needs to act now. I notice here you didn't say anything about privatization of Medicare, Mike, which is what that 2025 program actually speaks to, is privatizing Medicare. So if you wanted to see the full resolution, that full resolution is here. You'll notice I took some liberty to highlight, as I usually do, Special Order of Business Protecting Seniors. This document, this resolution does identify that you're looking to make federal legislation to protect the safety net of Medicare and Social Security, that it should never be diminished or impaired as seniors built this country and have the right to assurance that their retirement years will be protected. Whereas the 2025 Presidential Transition Project, a blueprint for the first 180 days of the administration, wrongly equates Medicare as a source of national debt and calls for the repeal of the Inflation Reduction Act, including the Medicare drug price negotiation, which would stop billions of taxpayer dollars being saved annually and would therefore increase the national debt. What you're not saying, Mike, is that the 2025 presidential transition project also specifically states that it would privatize Medicare, forcing everyone into Medicare Advantage. I noticed she didn't say that anywhere. And if I word search the word privatization in this one document, it only comes up once about not privatizing Social Security. You don't say anything else about privatization of Medicare. I'm wondering why. So here is the 2025 mandate for leadership, the conservative promise that everyone keeps talking about. If you word search the word in this document, Medicare Advantage, it appears here 4 times. The Medicare Advantage qualifying payment arrangement incentive. So this is where they're actually looking to get more money out of the Medicare trust. Encourage more direct competition between Medicare Advantage and private plans. And make Medicare Advantage the default enrollment option. So, Michael, if you are not calling out that privatizing Medicare is part of the problem, we have a problem. Because then you are actually supporting what's in this document that your own union is speaking out against. And your own resolution from the AFT convention in Houston, one, had no participation from your retired teacher chapter. There were new retired teacher chapter leader Bennett Fisher or his board, which is your board, your retired teacher chapter. You never included them. And yet you made this resolution without them. And why else does the New York City Organization of Public Service Retirees have very little faith in this resolution that you made on July 24th? Because your union in 2007, the retired teacher chapter, passed a resolution to preserve and protect and increase the benefits of Medicare and prevent its privatization. And you trampled all over that. And then in 2014 and 2018, negotiated further diminishment of healthcare benefits, forcing everyone into a privatized, for-profit, inferior, predatory Medicare Advantage plan that you think is better because you built it. It is still a Medicare Advantage plan underneath. So I'm sorry. I have absolutely no faith in this thing that you just did. And of the hundreds of emails from retirees that we received, they don't have any faith in you either. We've asked for certain things, and we're going to make this ask formal right now, and we will follow it up with a letter. We are asking you, demanding you, rescind not just your support as you did at the MLC in a meeting and to the mayor that you were withdrawing your support for the Medicare Advantage plan, but you need to get the MLC to withdraw its amicus, taking the side of the city against your own union members out of the Campion case and the Bentkowski case. You yourself, United Federation of Teachers, must put an amicus in supporting our position. And you need to get behind our city and our state legislation to protect our healthcare from ever being diminished. Michael, you can't protect the United States of America when you're not protecting New York City retirees and your own workers who will be retirees. Save the people at home that you can, and largely go national. That's what we've been doing. Saving ourselves because no one else is, and working with national organizations to protect Medicare from being privatized and strengthen our safety net healthcare programs. Join us, Michael. I really think at some point you need to face the facts of what you're doing isn't convincing anybody. Mike, you have smart educators relying on you to do the right thing. and they see right through this charade. Please do the right thing. Because not only will they be calling you out, so will we. Have a good night.